and there is an adhesion between gold and tooth structure itself. So we might observe two things together, like cohesion and adhesion together. As I give you the example of gold filling, there is a cohesion between gold particles and there is adhesion between gold and tooth structure itself. On the other hand, adherent is a substance which we want to join. For example, our tooth structure is an adherent and filling material is also an adherent, and we join them together with the help of an adhesive. For example, if we put a super glue between two materials, so super glue is an adhesive and two materials are adherent. So what we need for that, we need adhesive or glue that can join two materials together, and we need to put two materials together very close to each other. If materials are far from each other, we cannot make bonding or we cannot make an adhesion. So these are 2 points which we need to focus on. Right. So this is important to understand what are the mechanisms or types of bonding, how we adhere our materials with tooth structure. So there are two major types. One is called mechanical and the other is called chemical. Right. In mechanical, we have two subtypes, macromechanical and micromechanical. As it is clear from the name, macromechanical, which we can see with our eyes, while the micromechanical we cannot see with our eyes. So in macromechanical, there is, for example, some undercuts, some screws or pins to hold the filling material. And this commonly used in case of amalgam. If you see this amalgam filling, what do you think? Can it come out of the cavity?
No.
It cannot come out of the cavity because it is given with undercuts. If you see, the bottom is broad and top is narrow. So due to this undercut, this filling cannot come out. So this is an example of macromechanical adhesion, which we commonly use in case of amalgam filling especially. In case of micromechanical, we treat a surface to make pores on the surface, microscopic pores. We cannot see with naked eye, but microscopically there are irregular pores. And in these pores, our material interlocks. If you see this image microscopically, the filling material and the tooth material, they interlock with each other and make a bonding. So this is what we see in case of micromechanical adhesion. And we use this technique, micromechanical adhesion, commonly with our resin composite materials. So I will have further details about this in next slides. So let's compare with the chemical adhesion or true adhesion. Why we give this a true adhesion? Because there is a chemical bonding between a material itself and tooth structure. So this we observe in case of glass ionomer and polycarboxylate cements. So there is formation of primary bond, as you must have read in chemistry, like ionic bond, covalent, metallic bond. So they are stronger bonds. So they chemically react with the tooth structure to make a chemical bond. So of course, this chemical bond is stronger and there is true adhesion. In tooth structure, we have calcium. As we all know, there is calcium in tooth structure. So that reacts chemically with carboxyl group present in these materials, and there is a chemical bonding between both materials. So these are the types of adhesion which we get usually. Now, this is important to understand which factors they affect on the adhesion of our materials with the tooth structure. What you think, what we need about the adhesion? We need a good adhesion or we need bad adhesion?
A good adhesion.
Yes, we need good adhesion. So all these factors, we will focus on good adhesion, how we get good adhesion. There are many factors, but I will discuss the most important ones, which I numbered from 1 to 7. And we will focus on how we get good adhesion. If adhesion is not good, for example, in case of filling, so patient will come back, my filling is lost. So even the patient will say the doctor is not good because filling a dentist made is not good. It is fallen away. So the first one is wetting. What do you understand by wetting? Wetting is the ability of an adhesive to wet the surface. So an adhesive should wet the surface properly. For this purpose, we will prefer low viscosity adhesives. For example, if I put a drop of honey on a surface, it will not wet the surface compared to water. If I put a drop of water, it will spread on the surface. So why is that? So this is
Because
due,
of the viscosity.
is because of viscosity, but viscosity results in formation of contact angle. If you see, this is example of for a viscous material or honey, for example. So it make a contact angle, which is very wide contact angle. So it will not make surface wetting. And comparely here, like for example, in case of some oil or something, the contact angle is low. And if we compare with, for example, water, the contact angle is 0. So contact angle 0 gives you maximum wetting. So accordingly, for good, we need good wetting. And for good wetting, good wetting, we need low contact angle liquids or low viscosity liquids. Other factors which affect are surface energy. Energy of the surface, because surface has higher energy and high energy will pull liquids to its surface. So if we have high energy, the contact angle will be reduced and it will give us high wettability and better adhesion. Similarly, in case of liquids, the comparative property is surface tension. If we have low surface tension of adhesive, it will give us better wetting and better adhesion. I know this is a little bit tricky, but I hope you understand this slide. So I briefly revise this. Wetting is ability to make a surface wet. And we need good wetting. And for good wetting, we need low contact angle liquids, which we get using low viscosity materials such as water, similar to water, and we use high surface energy adherents. Right. So what is importance of wetting or wettability in dentistry? Wherever we try to join two materials, we need good wetting. For example, soldering, if we are soldering two metals, we need solder to be low viscosity, giving us low contact angle and giving us good adhesion. Similarly, in denture retention, the denture surface should be wet. Otherwise, denture will not stay in the mouth. For example, if some patient's mouth is dry, the denture will not adhere to the tissues. We get more natural appearance when surface is wet by a thin layer of saliva. So therefore, when we compare, for example, tooth color, we use wet surface because it gives us more natural appearance. Similarly, wax pattern, which we make in the laboratory, you don't have much idea about wax pattern at the moment. But with wax, we make template of tooth structure, and then we coat it with a wetting agent to appear a smooth surface. So these are some examples where we apply wetting in dentistry. Other related factors are surface tension and surface energy, which I discussed in the previous slide. The surface energy, because surface molecules of any material have more energy because they are not pulled from all directions. Their surface is not getting any repellent force. So high surface energy will put adherent towards itself, reducing the contact angle and giving us better adhesion. So similarly, in case of adhesives, we need low surface tension. So they can give us low contact angle and better adhesion. Okay, the surface irregularities. As I mentioned, the surface should be in close approximation. The two surfaces should be in close approximation. There should not be a big gap or big irregularity. A little roughness is okay. That will help us to get good adhesion. But if there are big irregularities, we cannot make a good adhesion. Also, irregular deep grooves can trap some air bubbles, which can weaken the adhesion. So what we need from the surface, we can accept some irregularities, but there should not be gross irregularities. And there should be good approximation of two surfaces to get the good bond. Cleanliness of the adherent. The surface we are making a bond should be clean. If there is some contamination, we will not get a good bond. So surface contamination works in two methods. Firstly, it acts as a separating media. For example, if one surface we put some oil or some grease or some contamination, it will not adhere to the superglue because this oil or this grease will act as a contamination and it will not let you make bond with the contaminated surface. The other point is surface contaminants, they reduce the surface energy. So once they reduce the surface energy, we will not get a good contact angle and the adhesion will be reduced. We will not get that good strength. So therefore, make sure the surface is clean, which we are going to adhere. And next point is thickness of adhesive. The adhesive material we are using, we like to be thin material or low viscosity material, so we don't get a very thick layer of adhesive. For example, super glue is very low viscosity material and gives us a thin film compared to silicone. Silicone is a thick material and give us a thick layer of adhesive. Therefore, we get better adhesion with super glue. Also, we know all adhesives are in liquid form. So once they make a bond and they set hard, they contract, they make shrinkage. So if we use a thick film and more quantity of adhesive, we will find more shrinkage. So to conclude this point, we should use a thin film or very little quantity of adhesive. Otherwise, we will be facing zero point 0.5 stresses due to setting contraction. Because during the setting, the material will contract, the adhesive will contract and putting stresses on the interface. If we are using more material, thick adhesive, we will face more stresses at the interface. So which means it might fail the bond later on. Similarly are the thermal stresses. As we all know, in the oral cavity, we have variable temperature. So patient might drinking coffee or tea or might be eating ice cream. So temperature changes are there. So if we are using any adhesive which has a different coefficient of thermal expansion, it might act as a stresses. So the adhesive should have closely match thermal coefficient of expansion. So they expand or contract similar to the tooth material. And then finally, we have type of bond formed. As I discussed earlier, like the primary bond are stronger. For example, ionic bond, covalent bond, they are a primary bond and they make stronger adhesion compared to secondary bonds such as hydrogen bonding, van der Waals forces, they form weak adhesion. So these are the factors which we consider for making adhesion, and we cannot control all of these factors, but we try to improve these factors to improve the adhesion. Also, once there is a failure, there is a breakage of material, we should understand which factor we can improve or due to which factor it is failing. So this is really important. So to understand this, we have to understand the types of failure. So types of failure, understanding this is very simple. We might have adhesive failure or cohesive failure. So as it is indicated from the name, you can clearly understand what is adhesive failure. So adhesive failure will be between two dissimilar materials. If you see this picture, this is adhesive which can be clearly separated from adherent. So this is example of adhesive failure. While this is example of cohesive failure, the bond is there, the adhesion is there, but material fails within the material or within the material. And we might have mixed failure between two surfaces. We might face mixed failure. For example, some of the adhesive material is broken and some of the adherent is broken. So most commonly, we might see this type of failure in dentistry. Okay, what we get from this slide, failure of adhesive. For example, if we are getting failure of this type, so what we need to improve? And if we are getting failure of this type, what we need to improve? So here, for example, we need to improve the adhesion because the material is failing at the adhesion between adherent and adhesive. But in this case, there is nothing wrong in the adhesion. So we have a cohesive problem. Either we need to improve our adhesive or we need to improve our adherent. There is nothing wrong in the bonding. Right. So these are more examples showing Adhesive failure can be either interface. For example, if we are joining two materials A and B, and A can be separated from adhesive, still we call it adhesive failure. And if B separated from adhesive, still we call it adhesive failure. So adhesive failure can happen at any interface. Similarly, cohesive failure can happen within any material, within one adherent or second adherent or within adhesive. Still we call it cohesive failure because it is within the same material. So what is importance in dentistry? So this is importance of dentistry, importance of adhesion in dentistry. So where we joining two materials together. So you might not understand some of the terms which are clinical, but I try to explain to you. Decrease marginal leakage. So basically this is good seal. We are trying to seal cavity, so there is no leakage of bacteria or microorganisms. So this we can get with good adhesion. Prevention of tooth decay, you will read in next term, Pitt and Fisher sealant. So it also has the same purpose. We seal the tooth surface so no bacteria or caries can grow. Aesthetic coating, for example, if there is any defect, we can adhere some tooth colored material with the help of adhesion. Complete denture retentions, as I explained how we fix dentures with the help of saliva acting as an adhesive. Bonding agents for resin fillings, soldering and welding for joining two types of metals. Orthodontics, taquim, like putting brackets or wires with the help of adhesion. Conservation of tooth structure, putting some crowns, bridges, we have to use adhesion with the help of cements. Retention of artificial teeth to the denture base, and also dental plaque is adhered to tooth surface with the help of adhesion. So this is also important where we need to reduce adhesion. And we use mechanical brushing or this kind of stuff to remove tooth plaque. Is everyone with me? Any question?
Yes, doctor, please.
Okay.
What's the
So,
cohesive between black and teeth?
okay. Between plaque and teeth, there is cohesion and adhesion both. So the cohesion is between plaque itself. So the bacteria in the plaque, they are doing cohesion within itself. But there is adhesion between plaque and tooth surface. So this adhesion is a kind of mechanical adhesion which is attached to the surface. And we simply have to do brush to break this adhesion because this is not good adhesion. This is plaque or bacteria which is damaging our teeth. So here we need to break this adhesion. We have to remove this.
Doctor, black is bad or good?
Of course, it is bad because plaque attached to the tooth and it harbors various bacteria which damage the tooth structure, and we get caries or we get periodontal disease. You will read about it more in clinical subjects, inshallah. So there are conditions which are challenging and prevent adhesion in the oral cavity. By now, we understand adhesion is important. We need to get good adhesion. But there are certain factors which prevent adhesion, which we face challenge. For example, inhomogeneous composition of enamel and dentine. So this means the composition of enamel and dentine is different. So we need a material which can adhere to both materials with the same strength. For example, in enamel, we have more minerals, more hydroxyapatite, and we get good adhesion with enamel, but same material will give us weak adhesion with dentine. So this is a real challenge. Similarly, presence of water in the cavity. So where we get water from? So the water we get,
gland,
yes, from the gland.
salivary gland.
Okay, so from the salivary gland, we get the water, and we also get water from dentine itself, from dentinal tubules. So this water is bad for adhesion because it acts as a contamination. It contaminates the surface, reduce the surface energy, and we get poor adhesion. Similarly, surface irregularities in patient's oral cavity or patient's tooth cavity, we don't get a smooth, straight surface. So surface is uneven. So these surface irregularities will give us a challenge to make a good adhesion. Similarly, various scratches made by grinding burrs will give us rough surface. So if you remember previous factors, if surface is very irregular or narrow grooves, it might affect on adhesion. Similarly, debris in the oral cavity. So what debris we get in the oral cavity? As we all know, plaque. If plaque is there, it will act as a contamination and it will prevent adhesion. Similarly, when we grind enamel or dentine, especially the dentine, we get a layer of organic matrix, which is called smear layer. So this smear layer is contamination. So it prevents adhesion or even wetting of the surface and adhesion. So which means we have to remove this smear layer. Otherwise, we will not get good adhesion. So what we get from this slide, like we need to prevent water contamination. We should use dry surface. There should be no saliva, no water, no air, no oily stuff which can contaminate the surface. Surface irregularities should not be very gross. We try to make it as smooth as possible so we can get good bonding. And there should not be any debris like plaque or smear layer. If there is any, we should remove it. However, we get good adhesion with enamel, and that is due to the development of latest materials, because we might get chemical and mechanical adhesion with enamel, and enamel is a strong material which has very good high contents of minerals that help us to get good adhesion. It is worth mentioning here the micromechanical bonding or micromechanical retention, which we usually use for composite resins. So this is the technique which is most commonly used now and giving us the best adhesion of resin composite materials with enamel and also dentine. So in this technique, we clean the tooth surface. So the purpose of cleaning is to remove any decayed tooth, any plaque, any contamination from the surface. And then we etch it with phosphoric acid for 20 to 40 seconds. So so this is called etching, acid etching, because we apply acid that will remove any remaining smear layer any remaining bacteria, increase surface energy also, and give us micropores because it is acid. Acid produce micropores on the surface for better retention or better adhesion. Then we wash it and we dry enamel with the help of air, and we get white chalky appearance. So this chalky appearance means the etching is good and the surface is ready for bonding. So here it is shown in the shown schematically what we do in the acid etching technique. So we apply acid etching gel, which is phosphoric acid, leave it for 20 to 40 seconds, and then we clean it, wash it with water and dry it with air. And then we apply a bonding agent or adhesive, and then we cure it with light. So now surface is ready. One adherent, we make it ready. One adherent, we make it clean. We make it acid etch, and we apply adhesive to prepare it receiving the restorative material. Now we add restorative material or composite material here and cure it again with light. So that will give adhesion between our material and acid etch enamel surface. And it will be a strong bond due to micromechanical retention. So how acid etching helps us? I already explained this all. Removal of surface debris, so we can remove all contamination. We can remove and decalcify prisms. So decalcification means we remove some of the minerals from enamel and make some pores on the surface. So through these pores, the material will flow inside these pores and lock. So this is why we use the term micromechanical interlocking, because these tags, they grow inside those pores and get locking of the surface. Also, it increases surface energy. If you remember the slide of wetting, increasing surface energy will improve the wetting, will lower the contact angle and give us better adhesion. Also give us surface area. So better surface area will give us good bond. Low surface area will give us weak bond. I hope everyone is clear about acid etching technique and bonding with enamel. Let's continue to dentine because we have some difference in dentine. In the tooth, we have two main structures, enamel and dentine. In dentine, we have more organic matrix. And when we grind it, it makes a smear layer. So these are dentinal tubules, which are clean and open. But once we grind it, this smear layer forms on the surface. So this smear layer is a contaminant. So this acts as a contamination, which means it will prevent bonding between material and tooth itself or dentine itself. So this is why adhesion with dentine is more difficult or weaker. But luckily we have enamel outside, so we get stronger bond with enamel. So that is why weaker bond with dentine is covered. The factor which affect on weak bonding of dentine include less minerals or less hydroxyapatite. This H is for hydroxyapatite. And more collagen. Also, we have fluid, which can contaminate, dentinal fluid. Low mineral contents, high organic contents, smear layer. So therefore, acid etching of dentine decreases its surface energy also. So these are the factors which lead us towards weaker bonding with dentine, and we should consider these points. We can use amalgam bonding. We can use similar, although we use acid etching mainly for composite reasons, but we can also use for amalgam bonding using the same process. In the prepared cavity, we apply acid etching and bonding and then pack it with the amalgam. But most commonly, we use acid etching for resin composite materials because they are designed for micromechanical retention. In amalgam, we get retention by macromechanical mainly. So how we test the adhesion? Either we are getting good adhesion or bad adhesion, or because once we have different materials, we have to categorize which make a good bond or good adhesion with tooth structure. So we test the bond strength. We attach a material with tooth and we test how strong is the bond. Is it making bond like a super glue, or is it making bond like a normal glue, or is making like a bond like silicone? So each one has a different strength. Similarly, we use shear bond strength or tensile bond strength to evaluate our materials. So currently available bonding agents shifting the bonding failure from cohesive to adhesive. So which means the bonding agents are very good now and the failure is adhesive mainly now, not within the adhesive itself. So this is example of bond testing. How we test shear bond and tensile bond. So you need to understand the difference between both types of testing. Of course, as a student, you are not meant to do this kind of testing, but at least you should understand the difference, how this testing works. So if you see, we have two materials, this one and this one. And in the shear area, we apply adhesive or bonding agent or which material we need to test. And then we put into a machine and try to separate these two materials. And force required to separate these two materials is recorded. So that gives us a shear bond strength of the material. Practically, we remove the crown and attach our material. And then we make a slice. And then we test this shaded material, and this is tooth structure, and here is a bond. So we test how much force is required to break this bond. Another simplified example, if you see this shown in the tooth structure, we remove the crown and we put composite material with the help of adhesive system. We took an extracted tooth, for example, remove the crown, add filling material, and then we make slices. Each slice we get filling material or composite material bonded to the tooth structure. This yellow in color. Gray is material, yellow is tooth structure. And this is sample for ready for testing. So we have in the tooth structure indicated by yellow, we have enamel or dentine, and here we have a composite filling material. Here we have bond. So we will apply force to test how much force is required to fail this bond. So that will be our bond strength. So in bond strength, we can either apply tensile force. This is tensile force, pulling these two components apart and how much force we need. This will give us tensile bond strength. But if we apply force like this way, from one lateral side, so force required to break this is called shear bond strength. So both methods are commonly used to evaluate these materials, like what is their bond strength and how we uh, check it. Yes, I'm ready for questions. If you have any question or you do not understand.
Doctor,
Yes.
can you explain the meaning of wetting again?
Okay. Are you on that slide on wetting?
Yes.
Okay. So is everyone with me on wetting slide?
Yes, doctor.
Okay. So what is meaning of wet? To make something wet, we need good wetting, which means we need to make surface wet. For example, if you have to bond two surfaces and half of the surface remain dry and half of the surface is wet with super glue, you will get a weak bond compared to if you make full surface wet with super glue, it will give you a strong bond. So same is the importance of wetting. And how wetting, okay, how wetting is affected? It is affected by various factors such as contact angle, first of all. So we need low contact angle. I explain the contact angle when we put a drop of liquid on a surface, as it is shown. If you see the image, the round ball, which I can give you example of honey in this round ball. Okay, the honey will make a high contact angle and it will make less surface wetting. If you compare next one, the yellow bubble, which I compare with, for example, some oil. So it will make medium contact angle, which is less than 90, but still it is a high contact angle and will give you medium wettability. Compared to some liquids such as water, super glue, which giving you contact angle 0 or very low contact angle, it will give you high wettability. So high wettability means you will get good surface wetting and good adhesion, because the adhesive will spread on the surface and it more surface and adhesive will be available for bonding. Similarly, the surface energy, if you have high surface energy will pull adhesive towards itself. So it will reduce the surface angle again and it will increase the wettability. And same is the case in surface tension, but low surface tension will give good wettability and good adhesion. Yes, is it clear now or still you have any confusion about
Yeah.
wetting?
Yeah. Thank
Okay. Yes, any other question? No more questions? So either I explain very well or you did not understand well.
you.
Yes.
Adherent is the material that attach the filling, or how I can explain. Adherent material
Okay.
that
No,
attach.
I get your question. I get your question. I get your question. Okay. So there are two things. One is adhesive and one is adherent. So adhesive is like our super glue. or our, for example, scotch tape or silicone. The material which makes bonding, that is called adhesive. Okay, and the adherent is which material we need to join. Okay, for example, if you have a broken door, okay, so door is your adherent, and the super glue which you use to make a bonding of broken door is called adhesive. So in dentistry, we have tooth as adherent, and we have bonding agent, or we have uh, like the bonding or adhesive we apply is adhesive. And filling material is also adherent. Are you clear about it?
Yes, thanks.